Thank you for listening to Depictions Media Radio. Welcome to Policy and Rights, the show about human rights and government policy. And welcome back to Policy and Rights here on Depictions Media Radio. And of course, I am Michael Clogs, your host. Climate crisis is real. The pandemic is real. Our world and our environment is changing around us and changing in ways that is hurting our way of living as we know it right now. In some ways, the pandemic and climate crisis may actually be related. Maybe the temperature rising has had an effect that released something, a virus that was buried in the ground, out into the air. Maybe not. But we do know that in order for the human race to continue the way we want to, that we need to adapt and we need to adjust what it is that we're doing in order to keep a safe environment for us as beings to thrive. So in this next segment, and that you're going to hear from the WHO is about climate change and what it is that we need to focus on so that we can stay healthy. What do we need to do in order to stay healthy with our environment? So let's listen to this press conference from the WHO about climate change and how we need to adjust things that we're doing in order to survive as a species. Thank you for listening to Depictions Media Radio.
Thank you very much. Good morning, good evening, good afternoon. It's my great pleasure to welcome all of you at this press conference to launch WHO COP26 special report, The Health Argument for Climate Action. This report spells out the global health community's prescription for the climate action based on the growing body of research that establishes the many and inseparable links between climate and health. The recommendations in the WHO COP26 report are the result of the extensive regional consultations, which took place earlier this year and were hosted by WHO Civil Society Working Group and to advance action to climate change and in close partnership with WHO regional offices and other health partners. Thank you very much for your contribution. I would like to thank the numerous WHO colleagues and health partners who have contributed extensively to both the consultation and the report. I'm also very happy that the report is launched at the same time as an open letter signed by over 3/4 of the global health workforce calling for the national leaders and the COP26 country delegation to step up climate action. COP26 is the first UN Global Climate Summit since the start of the pandemic, and with the health domaining the political agenda, that there is a clear opportunity for the voices of health professionals around the world to make a difference to these negotiations. I hand over to Dr. María Neira for the presentation of the key message of the report, and I wish you a productive and successful meeting. So thank you very much indeed, and Maria.
Thank you, Christian. Is that okay? Thank you, Dr. Yamamoto. And good afternoon, everyone. Good evening or good morning, depending where you are. It is my pleasure to present you today, and let me show you a copy, and I'm sure that you can have a look in our website. It's freshly announced, the health argument for climate action. You know, as you well know, in few weeks we will have the COP26, and everybody says that this COP has to be special, especially in the level of ambition and solutions and action and interventions proposed, political courage as well, and exceptional in the speed at which those decisions needs to be taken. And this is why the health community broadly, because it's WHO, of course, but behind and in partnership with WHO, there are many, many health professionals in the broad sense that decided to join us on this call for putting the health argument really at the center to accelerate the negotiations at COP26 in Glasgow this year. So we all hope that this recovery after COVID-19 could incorporate our health arguments, because we are convinced that the health will be the motivation to do much more and to accelerate action on climate change. The good news is that today we have signing a letter calling on the governments to do more on climate change, to tackle the causes of climate change, and we have 45 million health professionals signing. Let me repeat that because it's, I think, an incredible number. We have 45 million health professionals joining us on this call for a COP26 with the health argument at the center, and where health will be benefiting for all of the action that needs to be taken. The number is growing every day, so it's just 45 million today, but I'm sure it's growing. And of course, one of the signatures is the one of our Director General, Dr. Tedros. So we are all very happy to launch this call today, hoping that this voice of the health professionals, which normally is very credible and it has a lot of responsibility and it carries an important weight for the society, can be heard. What is the health argument? Well, the health argument for COP26 for climate action is the following. We know that climate change is affecting our health. That has been clearly demonstrated. Diarmid maybe later can elaborate a little bit more on that. But we know very well that climate change is affecting the pillars of our health: food, water, the quality of the air, and shelter. So as you can imagine, all of that will represent a major risk for our health, and therefore we need to invest on adaptation to climate change, on more resilient healthcare facilities and systems, and a more resilient society. But the positive message on the health argument is that whatever you do to tackle the causes of climate change will have enormous benefit for the health of the people. And those benefits for the health of the people will come essentially from the reduction of air pollution, for improving air quality. And let me put you the figures again on the table. Every minute, and this is a horrible figure that I always hate to put on the table, every minute we have 13 deaths caused by exposure to air pollution. The benefits of tackling the causes of climate change could be that if you reduce air pollution, if you reach the recommendations of WHO in terms of levels for particulate matter 2.5, we could reduce by 80% the number of deaths that are occurring every year due to air pollution. Imagine this represents 5.6 million deaths that could be safe, could be protected. Similar for if you do the transformation that is needed in terms of sustainable food systems, the healthy diets that will result will prevent as well 5.1 million deaths every year. Plus, other benefits will come from transport, physical activity, and activities related to finance in our society. So I think all of those arguments are very appealing, are very positive. Our society needs to understand that tackling the causes of climate change represents a public health agenda and a public health big opportunity. Most important, whatever you spend, whatever is the financial investment on tackling the causes of climate change will be outweighed by the benefits. So no excuses. The health argument is very strong, is very positive, and in fact our report is dedicated to the memory of, some people might know, particularly in Europe, the little Ella Kisi-Debra, who passed away with terrible asthma attacks for several years. And Ella is now one of those children who suffer a lot from air pollution, and we want to make sure that in future this exposure to air pollution and a more sustainable life can be ensured. So I invite you, all of you, to look at the health arguments, to use it wherever you live or wherever you work or wherever are your opportunities, because those are very powerful, very motivating. There are a lot to gain if we do it right, or a lot to lose if not. The health community has been asking for a health COP for many years. Maybe this one is the time for having it. It's the first step. We want a real health COP, and we want to make sure that we will measure the actions taken to tackle the causes of climate change by counting the number of lives that we are saving. That will be a fantastic indicator for all of us. Diarmid, can you remind us the 10 recommendations we are making, the 10 prescriptions that we are making on our health argument for climate action, please?
Thank you very much, Maria. And it's a pleasure to add some detail to what Maria has just outlined, because as she has said, many organizations are coming forward with recommendations, calls to action. We also have basically a positive offer of support from the health community to act on climate change, and that's why the report is the health argument for climate action, because we think health is such a powerful reason to act on climate change. So just quickly to run through those 10 recommendations. You can group them into three big groups. The first is things that we have to do in order to protect our health from climate change. And the first of these is to be aware that our health is not negotiable. We're going into climate negotiations, we're negotiating many things, but the life of a single child, whether it's lost to air pollution or climate change, is not something that should be on the table. So that's one of the key messages. There is a saying in the climate negotiations, particularly from the most vulnerable countries, of 1.5 to stay alive. That's we need to stay below 1.5 degrees centigrade warming in order to protect ourselves. We mean it in health terms. It really is a case of staying alive for many people around the world. The second of them is that we need to protect and restore nature. All health depends on natural ecosystems. We basically have to end this war on nature if we are to protect our health. Just a few days ago, the Human Rights Council recognized the right to a safe, clean and healthy environment, and all of those things are very closely linked. That we need to protect the environment, to protect nature if we are to protect human health. So that's number two. The third is a healthy recovery from COVID-19. Economies around the world continue to, quite rightly, pump in billions, if not trillions of dollars into keeping their economies afloat and resuscitating them after the slowdowns that have been forced from the COVID-19 pandemic. We at WHO have been clear from very early on in COVID-19 that this has to be done in such a way that it protects the environment in order to protect health, and yet we still see that about 80% of those investments, according to the OECD, are either neutral or harmful for the environment. We have to bring that balance more towards a greener recovery. And the final one in this set is to make health systems resilient. Health systems are the first line of protection of people against these climate risks. We know these climate risks are escalating. They're described in the report, and health systems are receiving very, very little support indeed to absorb this additional risk. So that's the things we have to do. Just quickly on the positive arguments, to elaborate a little bit on what Maria has already said. One of the recommendations is to gain the health benefits of climate action. And as Maria has already said, we know that if we were to comply with the Paris targets, the health gains alone would pay for the cost of mitigation twice over. So we need to value those gains and put them into our plans. We also, the next recommendation is to develop clean energy systems. Maria has just outlined this as well. It's to save a large proportion of those over 7 million deaths a year from air pollution. That includes, for example, a rapid transition away from coal and the gradual phase out of other fossil fuels. The next recommendation is to reimagine urban environments, and we're seeing cities around the world, including in recovery from the COVID pandemic, make it easier to walk and cycle, to look at greener spaces. All of those are good for the climate and good for health. And then finally in this set, to promote healthy, sustainable food systems. As Maria has just said, that could save over 5 million lives a year. To put that into that metric she has just used, that's 10 lives saved per minute if we were to implement those healthy, sustainable food systems. And the final two, one of them relates to finance. One of the big constraints that is often put forward for climate action is that it costs money. In fact, if you take into account the health gains, it saves money. IMF recently came out with a report that estimated that we are currently, as the globe, financing the fossil fuel industry to the tune of about $5.9 trillion a year. That's about $11 million a minute. And about half of that is the unpaid health costs of air pollution and so on. So we can save that money, get the health gains if we were to put it into healthier energy systems. And the final one of these, and again is the positive offer from the health community, is to let health workers speak up on climate change. We've just heard the numbers of health workers that are signing up to this letter to endorse climate action. We're about to hear from the International Council of Nurses. Health workers are not only numerous, they're probably the most trusted profession on earth. Where I come from, the only people that are more trusted than doctors are, in fact, nurses. So I'm pleased to hand back and to hand over to Howard.
Well, thank you very much, all of you, and what better way to hand over to Howard Catton, the CEO of the International Council of Nurses. Please.
Thank you very much. Good afternoon, good evening, good morning to you all. I am a nurse and I'm the CEO of the International Council of Nurses, and I talk to nurses around the world every week who tell me about how they see the impact of climate change on the health of people that they care for every single day in their practice. There are 45 million plus healthcare professionals who are witnesses to the health emergency that is unfolding in plain sight. Their voice must be heard and acted on. They see and work with young people struggling and old people struggling with respiratory disorders caused or exacerbated by poor air quality and pollution, people who can't go out, who are struggling with their tasks of daily living, who are losing function and whose independence is undermined. They support people who are not coping with extreme temperature changes, from heat stroke and exhaustion to hypothermia. And many of these people are most vulnerable with underlying conditions such as cardiovascular disease, which is made worse. And they see and experience extreme events and disasters like flooding and forest fires, which result in the spread of infectious diseases, including vector-borne diseases, the contamination of food and water that people can't avoid. And they see that the impact is not just on people's physical health, but on their mental health. Depression, anxiety, grief, isolation, symptoms of post-traumatic stress disorder. Climate change is stealing the hopes and dreams of people that people have for the future. Healthcare professionals also see the disproportionate impact on the most vulnerable in our societies, the poor, the marginalised, the displaced. Health justice is an expression of our humanity one to another, as well as being the building stones on which safe and cohesive societies are made. And it is for all of these reasons why 45 million healthcare professionals are not prepared to be silent witnesses and proudly support and have signed the joint letter to 197 global leaders and the call now for now being the time for climate action. Healthcare professionals also make the case for action because it is good not just for planetary health, but is good for our public health. The planet has become the patient, and like people, we need to focus on prevention. There's a virtuous circle between what we do for the public's and individuals' health and for planetary health. And also, as my colleagues have pointed out, healthcare professionals don't think that enough attention has been made to the economic case. The increased severity in health conditions, the increased frequency of deterioration in people's health, resulting in increased admissions and healthcare interventions. These are all things which have costs on our healthcare system and result in the loss of productivity to our economies. Investment in climate action on health is a best buy, and we need to much more seriously add health into the cost assessments of climate change. Healthcare professionals have, of course, been at the forefront of responding to COVID. They've seen up close, and often far too personally, the impact of a lack of preparedness of our health systems on their health as well as on patients. And it is why they have seen how investing in health rapidly also impacts on our whole way of life. Healthcare professionals have said to me, if you think COVID is bad, when it comes to climate change, you ain't seen nothing yet. It's the grandmother of all health threats. COVID and climate change are compounding each other, and they're adding pressures on already weak health systems and staff. And it's why business as usual is not an option. And it's why now we need to truly have health at the centre of all our policies: energy, transport, agriculture, water and food. And the final thought, I think that we are missing a trick, and it's something that my colleagues have alluded to already. Nurses and healthcare professionals live these problems. They walk beside those people most affected. They are the eyes and ears on the ground. That means that they understand the problems, but also what the solutions are. And they are trusted by the public. Leaders should stop overlooking them when it comes to policy advice. If you are not including healthcare professionals in your advice, then you are flying blind. Healthcare professionals will have strong representation at COP26, and we call on governments to replicate that in all of their national level policy decision making. Thank you.
Okay, in this next segment, we're going to be listening to Dr. Bonnie Henry and Adrian Dix talking about what is going on in British Columbia as far as the pandemic. Of course, the going theme in British Columbia is that it is now the pandemic of the unvaccinated. They believe that the unvaccinated are the root cause of the pandemic at this point, and that through programs using vaccination ID cards and restrictions to restaurants and public sporting events, and also imposing mandates to certain workers that if they don't get vaccinated, they will lose their jobs, that we can put an end to this pandemic. We can find our way on the other side of it. Some of the things that aren't being addressed or said is the fact that, of course, Pfizer announced that their vaccine was only good for 6 months, and that there is a Merck COVID pill out there to help ease the effects of COVID-19 and what it does as a disease to the human body. So let's listen to this next segment with from British Columbia. Thank you for listening to Depictions Media Radio.
Good afternoon. My name is Adrian Dix. I'm BC's Minister of Health. To my right is Dr. Bonnie Henry, BC's Provincial Health Officer. This is our COVID-19 briefing for this week. I'm honored to be here on the territories of the Musqueam, of the Squamish, of the Tsleil-Waututh First Nations. We'll have our written report for the weekend case numbers, hospitalizations, other critical information. It will be with you before 3 o'clock today. And in addition, the surgery numbers, which typically we do on Tuesday, will be provided later in the week, the number of surgeries canceled. So you'll expect that later in the week, and those other numbers will come in our written report before 3 o'clock. And with that, it's my honor to introduce Dr. Bonnie Henry.
Thank you very much and good afternoon. So today I'd like to provide the latest update on our ongoing COVID-19 public health response. For many months now, as I don't need to say, I think, as COVID-19 continues to circulate in our communities, I've been asking everyone to take steps to protect yourself and those around you. And those steps remain as relevant and as important as ever. As we learn more about this virus, we have adapted our approach, and with us, step by step, have been millions of people in British Columbia. We've seen now how interconnected we all are, that the choices we make affect not only our own health and well-being, but it affects the health and well-being of our communities, our families, and our province. And we're seeing that with the challenges that are faced in different parts of our province. The actions we take or choose not to take affect the children in our lives, affect our elders and seniors, our neighbors, our friends. And we know the numbers over this past weekend have been stable, but they are still very high. And that means that we've had, again, increasing impact on our hospitals and our critical care. With this in mind, I'd like to address the situation we are currently facing in BC's north. We have been closely monitoring the situation in the north, and my public health colleagues and I are very concerned with what we continue to see in many communities across the north. COVID-19 is spreading at a higher than average rate. People are becoming severely ill, even young people, mostly unvaccinated younger people, and hospitals are pushed to the limit across the north. This is directly related to the vaccination rates in the communities where people are living. Communities with lower rates of immunization have higher rates of spread. The illness and the risk for everybody goes up. To address this, we have already put in regional health orders and are actively working with the Northern Health, my colleagues, to determine what additional measures we may need to break the chains of transmission across many communities in the north. For everyone, and especially people in the northern BC communities, we need to get back to the basics, the things that we know prevent transmission of this virus that we transmit to the people we are closest to, our family, our friends, our loved ones, our communities. We need to determine if there's additional measures that we need to take as well, and we need to ensure we're using all of the layers of protection we have available. That means washing your hands regularly, staying home when you're unwell, wearing your mask, particularly when you're around other people who are more vulnerable and in indoor public spaces, keeping a safe distance from others, and also getting vaccinated. It is not too late to make a difference for your own health and to protect your healthcare system and your community. We are also looking at whether we need to use booster doses in certain communities as a way to manage some of the severe illness and the outbreaks that we are seeing. We know that private gatherings, ceremonies, funerals and celebrations are a source of transmission, and it's transmission not just within a community, but people going from community to community. So I also want to remind the organizers of these types of gatherings and faith leaders in particular to ensure that you are using the guidelines that we have in place to protect your congregations, that you're ensuring everybody wears a mask in the indoor spaces, that you are carefully considering how or if people are coming together with high risk in communities right now, and making sure that you can provide those virtual and online options that support people, particularly people who are more susceptible to severe illness or death from COVID-19. During this time of high risk, we need to go back to those basics, those things that helped prevent transmission in our communities. And what I'm asking people to do is not new, but we know it works. And those communities that are impacted now, we are seeing the effects of the stress on our healthcare system in the north, and that means people being transferred for critical care, and we know how stressful that is on families to not be able to be with their loved one when they're in serious condition. My healthcare colleagues across this province are also stretched, and we are tired. It's been a long 20 months, and I don't need to say that to people in British Columbia. It is so hard for us to see a preventable illness now affecting people across the province. And that is because we need to get vaccination rates up to protect people from having severe illness. A number of things that we are doing right now. Today, the provincial health order, the provincial health officer order requiring COVID-19 immunization for all those working in long-term care and assisted living has come into effect. And a similar order will be in place for acute care and community care that will come into effect later this month, and that order will be posted later today. Together, these orders apply to healthcare workers in all settings and all workers in healthcare settings. It is very broad for the very reasons that we know that these are settings where transmission causes strain on the system if healthcare workers are infected, but also can mean transmission to those who are most vulnerable to severe illness. I want to thank all of the healthcare workers who, for your own reasons, may have delayed getting your vaccine, but have now taken this important step. It is not too late. Few know better than those working in long-term care and assisted living what the impact of COVID-19 has been on our seniors and elders, particularly those who live in long-term care. As our seniors advocate has highlighted, it is these people who have suffered the most, both from COVID itself, but also from the measures that we've had in place to try and protect people. And I am incredibly grateful that you are doing all you can to support them and keep them as safe as possible as we weather this next phase of the storm. It is also important to know that this is a measure that protects you as a healthcare worker and keeps you able to care for those who are more vulnerable. It protects our healthcare system, our families, and our communities. I recognize as well that our public health mandates have changed over time, and they will continue to do so as the pandemic evolves and changes. And just as we may increase or decrease public health measures to ensure our protections are in step with our risks, we also want to keep things as straightforward and as simple as possible. So recognizing that young people are now wearing masks from K to 12 in our school system, I'm adjusting our public mask mandate and requiring it for everyone 5 years of age and older to wear a mask in all indoor public spaces. And that will be posted in the updated order today. For youth, whether taking the school bus or the city bus, the rules are the same. And I just want to say how impressed I am. I continue to be amazed at the adaptability and the resilience of children across this province, and many of them have told me that it's that they know how to wear a mask now, and that it's something that they do to keep themselves safe, to keep their families safe, and I just want to say thank you. We are also, as you may have heard, readying our province to be able to provide COVID-19 vaccines to youth 5 to 11 years of age as soon as the vaccines are approved for use by Health Canada. And we have heard that at least the preliminary data package has been submitted to Health Canada, and we may have that important vaccine available to us as early November. So we continue to talk with school communities, families, and parents to ensure the process will be as seamless as possible for everyone and make sure that our logistics are all in place so that we can provide this vaccine as soon as it's available. In the meantime, parents can now pre-register your children in the same way that we have registered ourselves or older children over the past year and a half. Notification of eligibility to book an appointment will be provided as soon as these vaccines are approved for use by Health Canada, and we have a sense of when they're going to be available to us in the province. So we are continuing to do what we need to do to make sure we can roll out that program to protect younger children as soon as the vaccines are approved. I'm also very pleased to see more and more businesses across BC and across the country are bringing in vaccine requirements in their workplaces. And we know that this is something that will protect employees, will keep workplaces safe, and keep businesses functioning safely. So I encourage everyone to take this important step as well. The COVID-19 pandemic has evolved, and so have we. And we need to continue to evolve to deal with each new twist we are faced with. We will continue to be nimble in our approach and adjusting as needed as we continue to weather this storm together. Things have changed and will continue to change, and as many people may have heard, the U.S. has recently announced some changes to their upcoming requirements for travel to the U.S., and they have recognized AstraZeneca, which is an important step for I know many people in this province who receive that really important vaccine. I know they are also continuing to look at mix and match vaccines, as many countries around the world, the UK, France, Italy, ourselves, have used these important combinations. And the data that we presented here from BC and from across Canada shows how effective the mix and match combinations are. And I know our colleagues in the US Centers for Disease Control are looking at those data as well, and we expect to hear more about this important issue, which I know affects a number of people in British Columbia as well in the near future. I also want to make sure that you know that we are also looking at whether third doses or booster doses are needed for populations in British Columbia. As you know, we've provided a third dose to complete the series for people who are immune compromised, as well as starting a booster dose for residents of long-term care. We are looking at other populations, and we'll be gathering that data and looking at how we might roll those out in the future. I want to assure everybody that we have enough vaccine for everyone, whether it's for someone in long-term care, for a first dose for children, or if and when a booster dose will be needed. As I've said before, we will weather this storm by all of us continuing to do our part and supporting each other along the way. And I think right now, after this weekend, it is particularly important for us to thank healthcare workers across this province. It has been a long, hard road, and we know that you are showing up every day and caring for people across the province who need the services that we have in our healthcare system. And I want to add my gratitude and thanks to our healthcare workers. We need to continue to do our part by following all of our layers of protection. We need to do this with resolve and determination, as we have been through this last 20 months, as well as our commitment to each other to get through this by being kind to each other, being calm and being safe, and getting vaccinated. Thank you.
Thank you very much, Dr. Henry. I wanted to start today by speaking about the situation in the Northern Health Authority. And just to put it in context, over the course of the pandemic, different areas of the province have been affected by COVID-19 differently, and we have all supported one another. We've all been all in to support one another throughout the pandemic, and that continues to be the case. The situation in Northern Health Authority is extremely serious at the moment. I just want to lay it out with one set of facts. We have now transferred critical care patients. 55 critical care patients have been transferred from Northern Health to hospitals on Vancouver Island, in the Fraser Health Authority, and Vancouver Coastal Health. Of those 55, 43 are positive for COVID-19. 42 are not fully vaccinated. 42 not fully vaccinated people transferred in critical care. Over the Thanksgiving weekend, yesterday, Monday, Thanksgiving Monday, 4 people were transferred from Northern Health to either Vancouver Island or Metro Vancouver. On Sunday, 1, on Saturday, 5, on Friday, 4. That's 14 people transferred. I want to put in context these numbers in terms of the critical care beds that are in place for everyone in Northern Health, that usually, in fact, more than satisfy demand. They're in ordinary circumstances, pre-pandemic circumstances for critical care, although there are many challenges everywhere in our healthcare system. That is regularly the case. We have 40 critical care base beds in all of northern British Columbia. There are 42 patients with COVID-19 from the north in critical care, not just sick enough to be in hospital, but in critical care today in hospitals in the south. There are 23 further surge beds that have been added to our critical care capacity in the north. That makes 63. We have patients in those beds, in the base beds today, and obviously the pressure of hospitalization in all our hospitals, particularly in UHMBC, where our staff of doctors and nurses and health sciences professionals and healthcare workers are doing simply epic work to support people, dealing in particular with COVID-19. This is where we find ourselves today. 55 patients transferred. Over the weekend, over this Thanksgiving weekend, 14 patients flown from communities in the north, hundreds and hundreds of kilometers. It's about 800-900 kilometers by air as the crow flies from Dawson Creek to Victoria, for example. Transferred this weekend. That's how they dealt with their Thanksgiving weekend. And I want to assure everyone in the north, we are all in to support them. On contact tracing, on support for healthcare workers, 55 transfers. We added 2 planes that we have worked with the private sector to add to our BCHS fleet over the weekend. We are all in to support them. But the people I want to speak to today are people who today are walking in communities in the north. Because the people in critical care right now, we're just going to provide them with the best care in the world and support their families and do whatever it takes to help them and help them get well from this vicious, nasty virus. But for those people walking around unvaccinated, who might be in those critical care beds in 2 or 3 weeks, I say to them, now is the time, surely. Now is the time to get vaccinated. With the whole healthcare system all in support, now is the time to get vaccinated. And I'm going to read off some of the clinics, some of the locations of the clinics across the north. And this is true, by the way, of everyone in BC who's unvaccinated and needs to get vaccinated right now. At the Lake Districts Hospital in Burns Lake, at the Chetwynd Primary Care Centre, the Tansy Friendship Centre, at the Chetwynd and District Rec Centre. There are different immunization clinics coming up. At the Dawson Creek Health Unit, at the Stikine Health Unit Center for the Dease Lake area, the Fort Nelson Health Unit, the Fort St. James Health Center, the Fort St. John Health Unit, the Northern Lights College campus. There'll be vaccination clinics at Old Fort Road. In Fraser Lake, at the Fraser Lake Community Health Center. In Grand Isle, at the Grand Isle Health Center. At Rinch Memorial Hospital in the Hazelton area. At Coast Mountain College in Houston, at the Hudson Hope Health Center, at the Kitimat General Hospital Multipurpose Room, at the Mackenzie District Hospital, in Macedon area at the Howard Phillips Hall, in McBride area at the McBride Health Center, In Prince Georgian area, the Carriacicani Family Services and the CN Centre and the Prince George Conference Centre. In Prince Rupert, the Core Space, the Charles Hayes Secondary School, Prince Rupert Community Health Centre, in Quesnell at the Quesnell Senior Centre, in Smitherson area at Coast Mountain College Smithers Campus at the Healthy Living Centre, in Southside area at the Southside Health and Wellness, in Stewart at the Stewart Health Centre, in Terrace at Coast Mountain College at the Terrace Health Centre, in Tumbler Ridge at the Tumbler Ridge Medical Clinic, in Valemont at the Valemont Health Centre, in Vanderhoof at the Vanderhoof Health Unit, in the village on Haida Gwaii, the Haida Gwaii Hospital and Health Centre. I just want to say to everybody that we need to come together now and raise vaccination levels. You know, and I know, the vaccination levels are high across BC. 88.8% in our province, across our province, 82.6% fully vaccinated of all those over 12, which is impressive by any standard, but we simply need it to be higher. And I'm asking everybody to be part of this effort, to continue to be part of this effort, and to continue to support this effort. As Dr. Henry has said, the requirement for mandatory vaccination in long-term care and in assisted living comes into place today. And I just want to take you through some of the numbers with respect to that so that you have a sense of where we are and the preparations that have been made for this important and significant milestone, not just for workers, but to keep our long-term care homes safe. There are 546 long-term care and assisted living homes covered by the order. We had the data for 542. We're working with the other 4 care homes that we have. This reflects the data in 542 out of 546 care homes. We have 48,879 staff reporting in total in assisted living and long-term care. The number of people who received their first dose is 46,924, or 96%. The total of received second dose is 45,457, or 93%. The total remaining is 1,955. In assisted living, vaccination rates are slightly higher. It's 97% overall, 94% second dose. And so of the 7,789 staff reporting in assisted living, 7,555 have received their first dose, 7,322 their second dose, there are 234 remaining. In terms of long-term care across BC, there are 43,304 staff reported, 41,572 have received their first dose, 40,273 their second dose. That leaves 1,732 in long-term care. So 1,732 in long-term care, 234 in assisted living. I think that we would say that what that tells us is that we've seen from the time when Dr. Henry put the order into effect to present a significant increase in vaccination rates in long-term care homes, which were over 90% at the time, just over 90%, and are now over 96% across long-term care and assisted living. And we're going to continue to work with health authorities and care operators to make sure that all workers continue to have the support they need to get vaccinated. As a result of the change coming into effect, residents in the vast majority of care homes will have the same care as they do today, with the added confidence that everyone working in their care home is vaccinated against COVID-19. The province is working with health authorities and operators on a home-by-home basis to ensure that if workers do not make the decision to get vaccinated, contingency plans are in place to ensure residents continue to get the care they need. A lot of work has gone into this. And obviously, a significant portion of the remaining people who are not yet vaccinated or unvaccinated in the systems, a significant number of those are casuals and not scheduled to work these weeks, but adjustments have been made accordingly. If a long-term care or assisted living worker refuses to be vaccinated, they will be in breach of the Provincial Health Officer's Residential Care Preventative Measures Order, the Public Health Act, and employer policy. They will be subject to progressive discipline up to and including termination. The message remains: get vaccinated, protect yourself, protect your colleagues, and protect vulnerable seniors in long-term care. Long-term care workers who have received their first dose can, in certain circumstances, work pending full vaccination as long as they get their second dose within 35 days of their first dose and remain eligible to work. Additional measures, such as using PPE and rapid testing, will remain a requirement until they are fully vaccinated. With respect to contact tracing, I just want to report as to where we are. Since my last report, health authorities have hired an additional 43 individuals to support contact tracing, bringing it to 1,439 the number of contact tracers in place across the 5 regional health authorities and the Provincial Health Services Authority as of October 8th. That's 504 in Fraser Health, 198 in Interior Health, 159 in Northern Health, 198 in Vancouver Coastal Health, 129 in Vancouver Island Health, and 251 in the PHSA. There are plans to add dozens more across the province, and I'll continue to provide another update this week. In conclusion, I just want to thank, after this weekend of Thanksgiving in our province, all those healthcare workers who are working in the communities, our exceptional staff, and teams of paramedics and dispatchers, people who are in the air and on the ground in BC Emergency Health Services, our healthcare workers, our health sciences professionals, our nurses, our doctors, our folks in the community who are continuing to deal with 2 public health emergencies with courage and the dedication that we have come to expect from them. The fact that we've come to expect this doesn't make us any less grateful, it makes us more grateful. And I want to express my gratitude to all of them.
Thank you for listening to Depictions Media Radio.
Thank you very much. Mr. President, distinguished members of the Council, it is an honor to once more provide you with an update on the situation in Haiti, which is currently undergoing one of the most fraught periods of its recent history. Already reeling from the ghastly assassination of President Jovenel Moïse on 7 July, the country was struck on 14 August by a devastating earthquake which affected over 800,000 people in its southwestern peninsula. The 2 events have led long-awaited national and local elections to be further postponed. Meanwhile, insecurity has become rampant in Port-au-Prince as kidnappings are once again on the rise and gangs have extended their control over large swaths of the city. In addition, thousands of migrants who had sought better living conditions in neighboring countries are being repatriated. For most observers, it's difficult to envision an end to the country's seemingly never-ending crises, which have pushed the resilience of the Haitian people to the brink. Distinguished members, since assuming office on 20 July, Prime Minister Ariel Henry has spared no effort to reach a political agreement with the various factions of the Haitian polity. Adopting an inclusive and consensual approach, he has sought to create minimal conditions for the holding of legislative, local, and presidential elections, and thus steer a country in the midst of a profound governance crisis towards the regular functioning of its democratic institutions. In a positive step, actors from across the political spectrum and civil society organizations, including former opposition and ruling coalition groups, adhered to such an agreement on 11 September. The pact captures key demands expressed by national stakeholders, such as the formation of a new provisional electoral council and the inclusion of the diaspora. It also foresees the holding of elections no later than the second half of 2022. One can only hope that Haitian political and civil society leaders will continue to work together to find common ground around a common project that will contribute to fostering a more appeased climate in which decisive action can be taken and essential reforms enacted. To be sure, many points of convergence exist. For instance, there is a large national consensus on the need to reform the 1987 Constitution, a charter widely viewed as contributing to the recurrent political and institutional instability. The draft Constitution submitted by the Independent Consultative Committee to the Prime Minister on 8 September should provide a basis for further constructive and inclusive debate on ways to reshape the Haitian political system. Likewise, the reestablishment of security, especially in the Port-au-Prince metropolitan area, must be prioritized by Haitian authorities. Since June, a significant and sudden increase in gang violence has caused the displacement of some 19,000 people from the communes of Cité Soleil, Croix-des-Bouquets, Delmas, and the Port-au-Prince neighborhood of Martissan. The control that gangs exercise around strategic entry and exit points of the capital has had a detrimental impact on Haiti's economy and the movement of people and goods. Applying the recommendations of a team of UN police experts deployed from May to July, following a request from the late president, the Haitian National Police has sought to improve the effectiveness of its anti-gang operations by adopting a more balanced approach to prevention and repression, relying on increased police presence in problematic areas, and improving its intelligence gathering mechanisms. Yet an overstretched and under-resourced force alone cannot stem this worrisome rise in crime. Haiti's main security institution will not be able to achieve sustainable results unless its capacities are strengthened and government services are brought back to the impoverished neighborhoods that serve as fertile ground for armed gangs. Therefore, in addition to sustaining its efforts to reform the police with the support of the United Nations and bilateral partners, the government must implement a more holistic approach to addressing gang violence within the framework of the National Strategy for Community Violence Reduction, which was developed with UN support and endorsed on 5 July. Mr. President, Haitian citizens have unanimously condemned President Moïse's gruesome death and called for a thorough investigation into his assassination, one which follows due process and the rule of law. For the shroud of impunity which has long enveloped Haiti to begin lifting, and for justice to prevail in this as well as several emblematic cases, judicial actors must be allowed to work independently in an appeased environment with reassurance that they will be protected while undertaking the delicate task of identifying and prosecuting the perpetrators. The Haitian judicial system also continues to contend with the protracted challenge of pretrial detention, which affects 82% of the country's prison inmates, among the highest such rates in the world. National authorities must redouble their efforts to urgently address this issue in close consultation with all judicial stakeholders. Furthermore, it is imperative that the process to review the new penal and criminal procedural codes continue, as once promulgated, they will be critical to combating pretrial detention as well as harmonizing Haitian law with regional and international human rights standards. Distinguished members of the Council, the 14 August earthquake has added a new layer of complexity to an already dire humanitarian situation. In the face of the most recent catastrophe to befall the country, the United Nations reiterates its support to the government and people of Haiti and salutes the active national leadership and coordination of the post-disaster response and recovery. Even as relief operations are still ongoing, early recovery and the restoration of livelihoods must be strongly supported in areas affected by the earthquake. It is a race against time to ensure that children can return to school, that farmers do not miss the next planting season, and that people currently living in spontaneous displacement camps return to their homes as quickly as possible. We must ensure that Haiti does not become a forgotten crisis. I urge all member states to contribute to the $187.3 million flash appeal launched on 25 August to respond to the needs of those affected by the earthquake, as well as the $235.6 million 2021-2022 humanitarian response plan, both of which are currently only about one-third funded. Moreover, in the long term, the reconstruction process will need the full engagement of the government of Haiti, as well as the international community, to ensure greener, resilient, and more inclusive recovery. Similarly, while the United Nations and partners have worked closely with the government of Haiti to ensure it responds effectively to the COVID-19 pandemic, greater cooperation will be required to sustain and scale up testing capabilities, as well as to promote public health and social measures. With only some 60,000 vaccines administered to date and less than 1% of the country's eligible population inoculated, increasing vaccine uptake in the coming weeks and months will prove vital to protecting Haiti and its most vulnerable populations from COVID-19 and the threat of more transmissible variants. Mr. President, the situation in which Haiti currently finds itself can only be characterized as bleak. Nonetheless, there exist encouraging signs that only reinforce my conviction that through urgent, determined, and concerted action, Haiti's citizens can address the deep structural challenges as well as the governance and development deficits which feed their country's instability, insecurity, and ever-growing humanitarian needs. Along with the United Nations, the entire international community must continue to steadfastly stand alongside the Haitian people and their government as they endeavor to forge a path towards stability, security, and sustainable development. And I thank you.
Thank you, Mr. President. Congratulations on assuming your presidency for the month of October. I would like to convey Ethiopia's best wishes in the discharge of your responsibilities. I also thank our Secretary General. Mr. President, I don't want to hide my surprise in the convening of this meeting of the Security Council. We find it incomprehensible for this august body to discuss the decision of a sovereign state exercised within the domain of international law and sovereign prerogative. There have been several instances where governments had expelled UN staff and other diplomatic envoys for so many disclosed and undisclosed reasons. Did the Council ever meet to vindicate such a decision? Not to the best of our recollection. Mr. President, we truly hoped Council members would have the insight to leave this matter to the government of Ethiopia and the United Nations. At the outset, I would like to register our position that the government of Ethiopia is not under any legal obligation to provide justifications or explanation for its decisions. Excellencies, we are obliged to make reference to the basic norms of the United Nations and its humanitarian operations. The General Assembly resolution on guiding principles for humanitarian assistance, 46/182, provides the sovereignty, territorial integrity, and national unity of states must be fully respected in accordance with the Charter of the United Nations. The most fundamental element of the sovereignty of the state has to do with their prerogative to determine who enters, remains in, exists in their territory. When we appeal for support and work with the UN or other humanitarian operators, we have not forgone this fundamental right. Therefore, the government will continue exercising its due right and responsibility on monitoring and screening all humanitarian operators in Ethiopia. Any suggestion to the contrary is unacceptable. As to the legality of the decision, leaving the details aside, the UN itself can be quoted for arguing decisions of persona non grata apply to the UN as well. Mr. President, when it comes to the obligation of UN staff, the rules are unequivocal. Article 101, paragraph 3 of the UN Charter provides all staff members employed by the United Nations must have the highest standards of efficiency, competence, and integrity. In the context of humanitarian operations, integrity entails adhering to principles of neutrality, impartiality, humanity, and independence. It also requires respect for the laws and police power of the host state. Furthermore, they must respect the Code of Conduct of UN, which, among others, provides the following. First, UN staff shall neither seek nor accept instruction from any government or from any other source external to the organization. Second, staff members shall not use their office or knowledge gained from their official functions for private gain, financial or otherwise, or for the private gain of any third party, including family, friends, and those they favor. Third, staff members shall not communicate to any government, entity, person, or any other sources any information known to them by reason of their official position. These cardinal principles, for the safeguard of which UN staff enter a solemn oath and swear on their conscience, mean that in the presence of contradicting views, competing interests, political pressures, and all forms of temptation, the UN staff will remain neutral. In the presence of deceit, coercion, and vested interest, they will preserve their independence. And in the existence of consideration that may appear to be reasonable basis for decision, UN staff will be guided by humanity only. The UN staff, Ethiopia expelled, sidelined their oaths, the rules of professional conduct, and the principles of humanitarian assistance. Mr. President, let me cite few examples among the multitude of transgressions that we selected with great care and caution. Needless to say, the misconduct of few individuals doesn't speak to the professional and able team of the UN in Ethiopia or anywhere else. Rather, it speaks of the serious ethical dilemma that existed in the humanitarian operation in Ethiopia for the past 11 months. These individuals executed the conspiracy created by TPLF and its member to generate an image of extreme casualty that warrants quote-unquote humanitarian intervention and rescues the criminal group. To use their own words, they were looking to create a Darfur-like situation. They suddenly and overnight created 1 million victims of health disaster, while OCHA country office reports 2.8 million people that need emergency health assistance. The main OCHA office was made to report 3.8 million, only because that level of inflation of misery was needed to elevate the crisis to level 3. They categorized the situation in Tigray under IPC 5, based on data collected from a region of 6 million population by a single FAO staff and interpreted by 2 UN staff that are Ethiopian and open TPLF supporters based in Rome. They assisted in fabrication of false allegations submitted to the UN Security Council as a white paper. The white paper contained unfounded allegations, including the use of hunger as a weapon, and preferred the need to apply Resolution 2417/18. The former head of OCHA was made to report to this council, 152 Ethiopians died due to food shortage, while such incident had never occurred. They made up the data and went to the extent of disinforming this global security body. About 2 weeks ago, they reported 12 individuals died of hunger in an IDP camp, while the organization running the IDP camp, an internal organization itself, came out and stated the allegations are simply false. They implored UN agencies to conduct investigations outside of their mandate to meet the instruction of TPLF to generate exhibits matching the false allegation released on medias and to supposedly substantiate a case before the ICC. They didn't even show mercy to victims of gender-based violence. First, in violation of the protection of protocols of safe houses for victims of gender-based violence, they invited TPLF armed men and militia to the safe houses. In addition, they exposed the safe house before an international media and invited interviewers and interrogators to safe houses to intimidate victims and elicit testimonies. This, Mr. President, is happening in a city where close to 13,000 detainees and prisoners were released with absolute impunity, and thousands of armed youths are roaming in the streets, already creating terror on residents. These individuals recorded a UN staff meeting and gave a copy to TPLF for the sake of providing it with material it could use to back its false allegations. These individuals openly celebrated and make other UN staff cheer the so-called victory of TPLF and the withdrawal of the National Defense Forces from Tigray. They openly conducted activism in support of TPLF, a group proscribed as terrorists, and make political statements that instigate violence and inflame the conscience of the Ethiopian public. They assisted siphoning food, medicine, communication equipment, all other essential supplies and equipment and transfer to TPLF. Right before their expulsion, they were facilitating the deportation of ethnically segregated group of Ethiopian migrants from Saudi Arabia and their resettlement in third country in Africa for training and preparation before they join combat with TPLF. In effect, a parallel UN operation that completely sidelined the UN country office was created. Apart from the selfish interest of individuals, we have evidences that the entire endeavor is created by a higher and more sophisticated motivation that seeks to undermine the Ethiopian state and rescue the TPLF. Ethiopia deeply resents this experience. Mr. President, expulsion was not our primary course of action. In multiple occasions, we explained our concern to UN officials. On July 8, 2021, the Deputy Prime Minister and Foreign Minister of Ethiopia wrote a letter to the UN Secretariat explaining in great details the misconducts of the UN staff that require corrective measures. We also summoned some individuals and warned them to halt their misconduct. Nevertheless, the transgression continued unabated. Mr. President, we believe the UN agencies and their honorable role are undermined by these few individuals. Our request from the United Nations is, first, to deploy new staff that are aware of and will adhere to their professional code of conduct. Overwhelming majority of UN staff fulfill this requirement and would distance themselves from political mercenarism. The government of Ethiopia stands ready to assist expeditious deployment of the replacement. More importantly, we request the UN to review all the reports, statements, and assessments that were produced on the situation in Ethiopia in the past year. These reports and data and information they contain must be verified. This audit is necessary for us to build and sustain trust and advance the exemplary cooperation between the Ethiopian government and the United Nations. Mr. President, the United Nations is an invaluable development and humanitarian partner for Ethiopia for many years. I want to underscore the great values we attach to the support of our organization during this difficult time. We also believe majority of the UN staff we have the privilege of working with have the requisite integrity and decency. Mr. President, I would like to reassure this Council, the new Ethiopian government established with the popular will and mandate of the Ethiopian people to herald peace and prosperity stands ready to work with the international community to address long-standing and current challenges. We welcome and value initiative by leaders of our region, the African Union, and the support of the Secretary General Antonio Guterres toward sustaining peace and stability in Ethiopia. We assure you that we will facilitate the visa requests. No one should doubt the Ethiopian tradition of hospitality. What we ask is respect, dignity, and honesty, open and candid discussion. We will, as we did in the past, we will always stretch our hands to all those who treat us with dignity and equality. That is, and this is the story of an Ethiopian life since the time of the League of Nations. I thank you.
I thank the representative of Ethiopia for his statement and invite the Secretary General of the United Nations to take the floor.
Thank you very much, Mr. President. If there is anything I have cherished during all this period, is to maintain a very effective and operational relationship with the government of Ethiopia and with its Prime Minister, to the effect that I had many criticisms in the global media about that, accusing me of being biased in favor of the Ethiopian government. So it is with total, I would say, in a spirit of complete easiness, that I would like to ask you one thing, Mr. Ambassador. If there is any written document provided by the Ethiopian government to any UN institution about any of the 8 members of the UN that were expelled, I would like to receive a copy of that document, because I have not had any knowledge of any of them, and it would be very useful for me to detect if documents are given to the UN and not given to my knowledge. Then I have to investigate what has happened in my organization. So I ask you, please, Mr. Ambassador, to provide me as a copy of any of the written documents written by the government of Ethiopia about any of the 8 that were expelled by Ethiopia in this regard. And I would recall that twice I told the Prime Minister that if there were concerns about lack of, I'd say, lack of impartiality of the UN staff, that I asked him, please send me those situations for me to be able to investigate. Twice I asked it to the Prime Minister. Until now, I had no response to these requests. And so, for us, the question is very simple. We believe that Ethiopia has not the right to expel these 8 members of the UN. We believe Ethiopia is violating international law in doing so. And we are ready to cooperate with the government of Ethiopia in relation to any situation in which the government of Ethiopia feels that any member of the UN is not behaving in total impartiality, in total independence, as humanitarian law prescribes and humanitarian principles establish. I want to tell you, Mr. Ambassador, we want to cooperate with the government of Ethiopia because we have only one agenda in Ethiopia, and that agenda is the people of Ethiopia. Tigrayans, Amarans, Afaris, Somalis, the people of Ethiopia. The people of Ethiopia is suffering. We have no other interest but to help stop that suffering. Thank you very much.
I thank the Secretary General for his further clarification. The representative of Ethiopia has asked for the floor to make a further statement. I give him the floor.
Thank you, Mr. President. Mr. Secretary General, I hear you loud and clear. I fully understand and realize the support you have given to our people and my government as well. We know where your heart is. You have approached our issue with candidness, with candor, and we highly respect that. As to the asks, I will definitely communicate to the appropriate authorities, and we will, of course, expeditiously, and as I have made it clear in my statement, this is an issue that has to be dealt between Ethiopia and the United Nations. Whatever document that will be available will be submitted to your office, Your Excellency. I thank you.
Thank you very much, Mr. President. Mr. President, distinguished members of the Security Council, I thank Council members for the opportunity to brief you again on the implementation of Security Council Resolution 2118 on the elimination of the chemical weapons program of the Syrian Arab Republic. Since the last Security Council meeting on Resolution 2118, held on 2nd of September 2021, the Office for Disarmament Affairs has been in regular contact with its counterparts at the Organization for the Prohibition of Chemical Weapons, or OPCW, on its activities related to this matter. Per established practice, I held a monthly call with the OPCW Director General on 1st of October 2021 to receive an update and ascertain his views. As I have previously informed the Council, the ongoing COVID-19 pandemic has impacted the OPCW Technical Secretariat's ability to deploy to the Syrian Arab Republic. Nevertheless, the Secretariat maintains its readiness for deployments. Despite continued travel restrictions, the OPCW Technical Secretariat continues to undertake its mandated activities related to the elimination of the Syrian chemical weapons program and its engagement with the Syrian Arab Republic in this regard. Efforts by the OPCW Declaration Assessment Team, or DAT, are still ongoing to clarify all the outstanding issues related to the initial declaration by the Syrian Arab Republic to the OPCW. In this context, the OPCW Technical Secretariat remains of the position that the Syrian Arab Republic must declare all chemical warfare agents produced and or weaponized at the former Chemical Weapons Production Facility, or CWPF, that was declared by the Syrian Arab Republic as never have been used to produce and or weaponize chemical weapons. I have been advised that the OPCW Technical Secretariat has not received yet a response from the Syrian National Authority on the request for information and documentation regarding the damage caused to the declared former Chemical Weapons Production Facility, CWPF, during the attack on 8th of June 2021, reported by the Syrian National Authority. I urge the Syrian Arab Republic to respond to the OPCW Technical Secretariat as soon as possible, given that the damage caused to this facility is related to one outstanding issue recently opened by the DAT. As I have previously informed the Council, the Syrian National Authority also reported the destruction in the attack to the CWPF of 2 chlorine cylinders that were related to the chemical weapon incident that took place in Duma on 7th of April 2018. The OPCW Technical Secretariat additionally requested that the Syrian Arab Republic to provide information regarding the unauthorized movement of the 2 cylinders and any remains of their destruction. The Secretariat is still awaiting a response from the Syrian Arab Republic on this matter. Mr. President, I note that on 16th of August 2021, the Syrian National Authority responded to the OPCW Technical Secretariat's request to schedule the 25th round of consultations between the DAT and the Syrian National Authority. I understand the Syrian National Authority confirmed its readiness to hold the consultations from 11 to 27 October 2021. The OPCW Secretariat informed the Syrian National Authority on 25 August 2021 that the DAT was prepared to deploy in October 2021. It also expressed concern about how delays in the conduct of the consultations could impact Syria's compliance with its obligations under the Chemical Weapons Convention, as well as the implementation of the OPCW Secretariat's mandate. Unfortunately, on 23 September 2021, the Syrian Arab Republic reconfirmed to the OPCW Technical Secretariat its refusal to issue an entry visa to one member of the DAT for the upcoming deployment. In its response, the OPCW Technical Secretariat recalled that the DAT expert had deployed to Syria on multiple occasions over the past 7 years, and further referred to the applicable legal framework, which does not entitle the Syrian Arab Republic to select experts on behalf of the Secretariat. Given this regrettable situation, the Technical Secretariat confirmed that it would not deploy the DAT to the Syrian Arab Republic at this time. I have been informed that, with the aim of advancing the implementation of the Syrian Arab Republic's obligations and the OPCW Technical Secretariat's mandate, the Secretariat has invited Syria to send a delegation for a meeting in the second half of this month with the DAT at the OPCW's headquarters in The Hague. The OPCW Technical Secretariat has underscored that such a meeting cannot replace full-fledged deployments to the Syrian Arab Republic. As a result of the identified gaps, inconsistencies, and discrepancies that remain unresolved, the OPCW Technical Secretariat continues to assess that, at this stage, the declaration submitted by the Syrian Arab Republic cannot be considered accurate and complete in accordance with the Chemical Weapons Convention. I urge the government of the Syrian Arab Republic to facilitate arrangements for the deployment of the DAT as soon as possible. As has been stressed on numerous occasions, it is only through complete cooperation by the Syrian Arab Republic with the OPCW Technical Secretariat that all outstanding issues related to the Syrian Arab Republic's initial declaration can be closed. As noted at many prior Council meetings, the confidence of the international community in the complete elimination of Syria's chemical weapons program depends upon these issues being finalized. Mr. President, the OPCW Technical Secretariat still plans to conduct 2 rounds of inspections of the Barza and Jamraya facilities of the Syrian Scientific Studies and Research Center, SSRC, in 2021. The inspections of these facilities remain subject to the evolution of the COVID-19 pandemic. I have been advised that the Syrian Arab Republic has yet to provide sufficient technical information or explanations that will enable the OPCW Technical Secretariat to close the issue related to the detection of a Schedule II chemical at the Barza facilities of the SSRC in 2018. With regard to the in-person meeting between the OPCW Director General and the Minister of Foreign Affairs and Expatriates of the Syrian Arab Republic, I note that the OPCW Technical Secretariat and the Syrian Arab Republic have appointed officials in charge of preparations. I hope that the proposed meeting will be an opportunity to strengthen dialogue and cooperation between both parties. Mr. President, the OPCW Fact-Finding Mission, or FFM, remains in the process of studying all available information related to allegations of the use of chemical weapons in the Syrian Arab Republic, and continues to engage with the Syrian Arab Republic and other states parties to the Chemical Weapons Convention with regard to, and I quote, a variety of incidents. As previously reported, further FFM deployments will be subject to the evolution of the COVID-19 pandemic. I understand that following the issuance of its second report in April 2021, the Investigation and Identification Team, or IIT, continues with its investigations into incidents in which the FFM has determined that chemical weapons were used or likely used in the Syrian Arab Republic. The IIT will issue further reports in due course, subject to the evolution of the COVID-19 pandemic. I take this opportunity to once again state my full support for the integrity, professionalism, impartiality, objectivity, and independence of the work of the OPCW. Mr. President, on 21 April 2021, at its 25th session of the Conference of the States Parties to the Chemical Weapons Convention, adopted Decision C-25/Decision 9, entitled Addressing the Possession and Use of Chemical Weapons by the Syrian Arab Republic, suspending the rights and privileges of the Syrian Arab Republic under the Convention. According to paragraph 8 of this decision, the rights and privileges of the Syrian Arab Republic will be reinstated by the Conference of States Parties once the OPCW Director General has reported to the Executive Council that the Syrian Arab Republic has completed all of the measures contained in paragraph 5 of the Executive Council Decision EC 94 Decision 2. I have been advised that the Syrian Arab Republic has yet to complete all of these measures. I therefore reiterate once again my call to the Syrian Arab Republic to cooperate fully with the OPCW Technical Secretariat in this regard. Mr. President, distinguished members of the Security Council, it cannot be repeated often enough. There is no justification for the use of chemical weapons by anyone, anywhere, and under any circumstances. There are no excuses for an inexcusable act. We must remain united and determined in preventing their use or the threat of their use. Those who have used chemical weapons must be identified and held to account. It is an obligation on all of us. It is my sincere hope that members of this Council will unite on this issue. Before closing, I wish to echo the Secretary General's remarks to the General Assembly presenting our common agenda on 10th of September 2021. And I quote, "When we work together, there is no limit to what we can achieve." I thank you very much for your attention.
Thank you for listening today, and thank you for supporting us with our sponsors. Please go to depictions.media for more information and click on our contact link and let us know how we can help bring your story and help bring us to a better world. This show has been produced by Depictions Media. Please contact us at depictions.media for more information.